Good afternoon, folkers. Snapzilla Gorilla, aka The Definition, kicking it off with another video. Alright, so what I want to talk about today are a few things, okay? Now, number one, there's this cat, right? He calls himself an alternative news source, right? To kind of compete with mainstream media. This cat goes by the name of Tim Pool, okay? And he's been covering the coronavirus lately. And, despite the fact that he'll tell people, oh, don't panic buy, don't do this, don't do that, he'll give some information about the Wuhan virus and how it's killing people here and spreading there and all this other stuff, right? Well, let's go with the idea that the coronavirus is as real as the government and the mainstream media is telling you. All right. Now, let me point out that Tim gets all his information for the news that he brings people from mainstream media. Okay. And then a lot of the times he'll say how he doesn't trust mainstream media, or not even that he doesn't trust them, but he wants to give people an alternative viewpoint or an alternative perspective on the news. But again, he's getting all his news, for the most part, that from what I know, from mainstream sources. Okay. Now, I look at mainstream sources. I look at what they're bringing to the people. I look at what I go through all kind of sources. I look at what they're telling the people, how the bent that they have on it, how they skew things and all that other stuff. Because that's going to happen, right? There's always an objective behind what they bring to you. There's always an agenda. Okay. Now, yesterday, Tim puts out a story about how Italy's death rate for the coronavirus is at like 6.4%. Okay. And worldwide is 3. I don't know why I can't talk right now. Worldwide is 3.4%. Now, when people bring up the fact that the flu, the regular ass flu, the one that mutates every year, when people bring up the fact that the flu kills more people than this Wuhan virus, people like to say, well, the flu still has a lower death rate, okay? And the Wuhan virus has a higher death rate at 3.4. The flu is 0.1%. We have to understand something about the flu, though. The flu has infected many more people than the Wuhan virus, the coronavirus. Whereas the coronavirus still has yet to infect as many people. I believe the flu infects about 45 million people a year or something like that. Some crazy like that. Okay? Or 60 million, somewhere around that number. So we have to understand that the flu is more widespread. It's infected more people and has been at it longer. Okay? The Wuhan virus has not been around as long. It has not infected as many people. So you can't say that definitively that the flu has a lower death rate, because guess what? As more people contract the coronavirus, the more people who are going to get care, the more people who are going to actually be able to defeat the virus, and the death rate will lower. Okay? That's just the natural way it works. With these type of viruses, they don't kill very fast, and they don't kill very often. Like the Ebola. Ebola will kill goddamn near, 90, 80 some percent of the people that it infects, because it's a fast acting disease that causes hemorrhages, okay? Which means that you're bleeding from the inside out. The coronavirus doesn't do anything like that, okay? What it does is it attacks cells so that it can replicate itself. It takes strands of DNA from other cells or whatever the hell it does to replicate, okay? And of course, it wants to continue to populate itself, so it's going to infect more cells and more cells and more cells, and that's how you get sick from it, okay? And your body Your immune system is being sent out to fight this thing, which is why people have symptoms. Anyway, enough of that, right? Enough of that. Let's get into this. A lot of people like to bring up Italy's death rate and China's death rate. Well, we know China's different. China's the epicenter. Shit started in China, according to the reports. But let's look at this. We have to ask ourselves, and this is why, look, Tim got mad because people are questioning his motives behind giving his information. And they saying that he's fear-mongering. Oh, this is getting worse. Oh, what, blah, 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 using words that incite people, that incite a fear in some form of panic in people. Now, a lot of people follow Tim Pool. A lot of people watch Tim Pool's content. And so he has a huge voice out here in the world, just like others who might be doing the same thing. Just like these doctors, right? You have a lot of YouTube doctors, right, that like to call people like me conspiracy theorists and idiots, and we don't know what we're talking about, but they're giving you half-assed information that you can find out yourself if you just go look for it. And this is the problem I have with experts and mainstream media, because they're not going to give you all the information. So yeah, it makes you wonder, what is the agenda? And we have every right to. We have every right to wonder that. And I'm starting to look at the conscious community, particularly those who rock with Sonetta, the I'm in the Raw Squad, apparently, are pro-vaxxers, okay? And I got something for their ass, too. Now, they say, oh, everybody's scared to debate us because they don't got the blah, blah, blah. We shut down Dale Bigtree. Well, I'm going to tell you something about Dale Bigtree. I look at him as something of controlled opposition, just like Robert, the Kennedy guy, whatever his name is, the Kennedy guy he rocks with, the senator. I feel like first of all, they wasted time in the courts trying to force the people who make the vaccines to tell people what's in them. It doesn't matter what's in them. Well, that's information you can get. Why are you wasting money and resources trying to get shit that's already available? Listen, man, that's another story. Let me tell y'all, I'm going to give you information on why Italy might have more cases, okay? I'm going to get into a lot of different things because I'm tired of... See, this is the problem we have with Tim. Tim Pool went on a tirade talking about how, oh, blah, 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 and you call me a fearmonger, and, and I'm going to tell you why. All right? I'm going to tell you why. I'm going to tell you why I have an issue with how you're covering this. Because you're not giving all the information. Oh, Italy shut down. Italy has 6.4% death rate. Blah, blah this, blah, blah that. And they want to tell you that the death rate is going to increase as more cases increase? No. That's not usually... No, I don't think so, Pippin. But we're going to do this. I got information. Okay? And I'm going to go through it. The first thing I'm going to look at. Okay? First thing I'm going to look at. Let's look at why deaths from the coronavirus are so high in Italy. Now, this is from Scientific American, okay? ScientificAmerican.com. All right? Now, Italy now has the highest number of deaths from COVID-19 outside the mainland China. Now, this article was done March 10th, 2020. And the headline reads, why deaths from coronavirus are so high in Italy. Okay, let's go over that because I feel like it's important for people to know. All right. Deaths from the new coronavirus in Italy have soared in recent days, with the country reporting 463 total fatalities from the virus. Out of 9,172 confirmed cases as of Monday, March 9th. But why are the deaths in the country so high? Okay. Outside of mainland China, Italy has the highest number of deaths in the world from COVID-19, the disease caused by the new coronavirus. And the country's fatality rate from COVID-19 at 5% is higher than the global average of 3.4%, according to the World Health Organization. One factor affecting the country's death rate may be the age of its population. Italy has the oldest population in Europe, with about 23% of residents 65 or older, according to the New York Times. The median age of the country is 47.3, compared with 38.3 in the United States, the Times reported. Many of Italy's deaths have been among people in their 80s and 90s, a population known to be more susceptible to the severe complications of COVID-19, according to The Local. The overall mortality rate is always going to depend on the demographics of the population, said Aubrey Gordon, an associate professor of epidemiology at the University of Michigan. In this case, the reported mortality rate is age standardized, which is a way to adjust for the underlying demographics of a population, she said. Basically, the older you are, especially over the age of 65, the more likely you are to die from this virus. And Italy has a very 23% of the population is old as hell, over 65 years old. And many of the deaths are happening to 80 and 90-year-old people. You understand what I'm saying? Around that age, okay? Let's keep that in mind. This is what I haven't heard anybody talk about this, but I saw it in this article. You just got to go look for the shit. Okay. Given Italy's older population, you would expect their mortality rate to be higher on average, all else being equal, compared to with a country with a younger population, Gordon told Love Science. Okay, this is Aubrey Gordon, the professor of epidemiology. In addition, as people age, the chances of developing at least one condition that weakens their immune system, such as cancer or diabetes, increases, said Chris Johnson, an epidemiologist at Temple University College of Public Health. Such condition, and I'm citing these sources because that's what people love to go to when they want to prove to you certain things like, we should be very concerned about this virus and it's killing so many people and it's the worst thing since smallpox. Okay, well let's go with scientific sources then. That's what we're gonna do. Let's do it, because guess what? At the end of the day, there are some good experts out there that actually want to tell the whole truth about shit. They want to speak the real truth. So you have to go through all of it. You have to parse all of it. Okay? You have to bring all of it to the table. So don't let people scare you into not using some of these sources when you say that, certain experts are given not the complete information. So now when the expert is giving you half-assed information deliberately, that's when you tend not to trust it. But when you have people like this giving you all the information, like saying, look, this is basically what it is. It's not hard to find. Okay? But right now I'm going to go with these sources because that's what I'm using. Okay, if you want to look up other sources, be my guest. But this is coming from the New York Times. This is coming from the Temple University, University of Michigan. This is where this shit's coming from. All right. Another issue may be the number of people in a given area who require medical care. Having a lot of severely ill people in a single region could potentially overwhelm the medical system, and that's what it's all about. She noted that this was likely the case in Wuhan, China, where the virus outbreak began, and which saw a majority of COVID-19 cases in China. A recent report from WHO found that the fatality rate was 5.8% in Wuhan compared to 0.7% in the rest of the country. Now, from my understanding, there's a lot of smokers, a lot of old-ass smokers in China, in Wuhan, China. This is a respiratory disease, and you're smoking. So, yeah, you are more likely to die from any type of respiratory disease if you're a smoker. Okay? Finally, the country may not be catching many of the mild cases of COVID-19, which is probably definitely the case. Seeing as how all these doctors and nurses are telling you, we're not getting any of these tests. We don't have enough tests. We don't have tests. We can't test people. They're pleading. They're saying we don't have the test. We don't know who has it and who doesn't. We're just guessing at this point. A lot of it is guesswork. You understand? Even from the experts, a lot of the experts are guessing. And the same thing is happening here. You don't know who has what. They could be attributing a death to the coronavirus that has nothing to do with the coronavirus. It could be the regular ass flu. But because, it could be the case that, okay, these people are probably dying in their homes or they're dying at the hospital. And there's so much chaos. They're like, okay, the coronavirus cracked. This might be the coronavirus. You have all these symptoms. We're going to get into that. We're going to get into how the coronavirus, they say the coronavirus gives you pneumonia, right? Okay, we're going to get into pneumonia soon. Okay, bear with me. So, having a lot of severe, okay. Finally, the country may not be catching many of the mild cases of COVID-19. Often, as testing expands within a community, more mild cases are found, which lowers the overall death rate, Gordon said. This was the case in South Korea, which conducted more than 140,000 tests and found a fatality rate of 0.6, according to the Business Insider. So, South Korea has a 0.6 death rate, fatality rate. But they had 140,000 tests to administer. And then there's probably still going to be more after that. They only gave 140,000 tests. Could be more people who have the COVID-19 and don't even know about it. And it'll probably pass and they'll probably get over it. 0.6% in South Korea. We probably don't know how many people have actually been infected, Johnson said. People with more mild symptoms or those who are younger may not be going to get tested. Johnson suspects the true fatality rate in Italy is closer to the global fatality rate of 3.4%. Okay, and like I said, can't even say that. Still not enough people getting tested right now. Still not enough tests. So these people are pinning deaths on the coronavirus or sicknesses on the coronavirus when people haven't even been tested yet. You understand what I'm saying? Oh, man. Don't worry. I don't have COVID. Listen. Ridiculous. So, Italy has conducted a substantial number of tests, more than 42,000 on Saturday, March 7th. However, there is likely a quite sizable outbreak in the area, which would need even more testing to identify. Okay, that's one article right here. Y'all see what happened. Why the death rate may be so high in Italy. Okay. Now, let's see. Now, just to give you an idea, let me just give you an idea of influenza deaths, okay? Just give you an idea. And this is from International Journal of Infectious Diseases. Excuse me. See that? Now. Oh, shit, what just happened? Okay. Investigating the impact of influenza on excess mortality in all ages in Italy during the recent seasons. Now, this is about Italy, yo. This is about Italy. 2013, 14, 2000 through the 2016, 2017 seasons. Highlights. Let's go over some bullet points here. We got some highlights here. Highlights. In the winter seasons from 2013-14 to 2016-17, an estimated average of 5.29 million cases occurred in Italy, corresponding to an incidence of 9%. More than 68,000 deaths attributable to the flu epidemics were estimated in the study period. Okay? Italy showed a higher influenza attributable excess mortality compared to other European countries, especially in the elderly. When was this done? November 1st, 2019. This is when this was written. Okay? Italy showed a higher influenza attributable excess mortality compared to the other European countries, especially in the elderly. What was it? What was it? Fuck out of here. In recent years, Italy has registering peaks in death rates, particularly among elderly during the winter seasons. Influenza epidemics have been indicated as one of the potential detriments of such excess. The objective of our study was to estimate the influenza attributable contribution to excess mortality during the influenza seasons of the years that I just mentioned. They used Euromomo and FluMomo methods to estimate the annual trend of influenza attributable excess death rate by age group. Population data were provided by the National Institute of Statistics. Data of influenza-like illness and confirmed influenza cases were provided by the National Institute of Health. An indicator of weekly influenza activity, we adopted the Goldstein Index, which is the product of the percentage of patients seen in the influenza-like illness and percentage of influenza-positive specimens in a given week. Results, we estimated excess deaths of 7,027, 20,259, 15,801, and 24,981 attributable to influenza epidemics in 2013-14, 2014-15, 2015-16, and 2016-17 respectively, using the Goldstein Index. The average annual mortality excess rate per 100,000 ranged from 11 to 41, 11.6 to 41.2, with most of the influenza-associated deaths per year registered among the elderly. However, children less than 5 years old also reported relevant influenza-attributed death excess death rate in 2014-15, and 2016-17 seasons. So one child of 100 from one child for every 100,000 people, and 1.5 per 100,000 respectively for those years. Okay, conclusions. Over 68,000 deaths were attributable to influenza epidemics in the study period. The observed excess deaths is not completely unexpected given the high number of fragile, very old subjects living in Italy. Okay. So, that's 3 years. That's 3 years. That's a 3-year period. 68,000 deaths over a 3-year period. So that's about a 3-year period. About 22,000. About that. Over 22,000 a year if you spread it out over the 3 years. The observed excess of deaths is not completely unexpected given the high number of fragile, very old subjects living in Italy. In conclusion, the unpredictability of the influenza virus continues to present major challenge to health professionals and policymakers. Nonetheless, and it goes on to tell you that vaccines are most most effective. Okay, that's what they tell you. But if you know anything about the flu vaccine, it only covers the flu from the previous year. It mutates. They can't keep up with it. Okay? And basically, when you get the vaccine, you're bypassing all these immunoprocesses. Okay, the flu doesn't go directly into your bloodstream. It goes through your nose, in your mouth, and your eyes. It goes through it goes through your digestive tract, right? It goes through your esophagus into your stomach, where it encounters all kind of acid, and then after your stomach, it goes into your gut, where it encounters more of your immune system. And then, if it get past all that, then it goes in your bloodstream. And by then, it's probably weakened, and then your immune system has been given a heads up, like, look, this is what's coming. But when they inject that shit right into your bloodstream, oh goodness, I gotta go wash my hands now after this. So, yeah. You see that sneeze? That's part of your immune system fighting whatever it is. It's blowing it out of your body. Whew. Yeah, don't worry. I'm not COVID-19 up in here. Okay, so look. Oh, I just touched my face. What am I going to do? So, anyway. This is all I need to know about vaccines. They haven't been tested for impairment of fertility. They haven't been tested for mutagenic potential. And they haven't been tested for carcinogenic potential. That's all I need to know about vaccines. That's all I need to know. That's all I need to know that I'm not putting that shit in my child's body. Point blank and period. All right. Now let's go into... Excuse me. Okay. Now, let's get into this. This is from Medicine Net. Okay, medicinenet.com. All right. Seasonal flu kills 291,000 to 646,000 people worldwide each year, according to a new estimate that's higher than the previous one of 250,000 to 500,000 deaths per year. The new figures from the U.S. Centers for Disease Control and Prevention and other groups were published December 13th in the Lancet Medical Journal. The updated numbers, which do not include deaths during flu pandemics, not even flu pandemics, are based on more recent data from a larger and more diverse group of countries than the previous estimate. All right, so the data came from 33 countries that have 57% of the world's population and had seasonal flu numbers for a minimum of 4 years between 1999 and 2015. The information was used to create an estimate of flu-related respiratory deaths in 185 countries worldwide. The study found that the risk of flu-related death was highest in the poorest regions of the world and among older adults. These findings remind us of the seriousness of flu and that flu prevention should really be a global priority. Now, I found something that says that more people, the number of people receiving flu vaccines have increased, right? The number of flu vaccine recipients have increased, yet so have the flu-related deaths. Vaccines have increased, flu-related deaths have increased. No, not much more to say about that, my friend. All right. Now, people like to talk about pneumonia, okay? How the coronavirus gives you pneumonia, it's killing a lot of people, and that's, it gives you such bad pneumonia, okay? Now, this is a crazy number here. Now, this is from All World in Data, okay? It's a website, All World in Data, and it's written by Bernadetta. Okay, let's see. See, they got some references down here. as they typically do. Now this is a long article. You guys can check it out yourself. I'll put all this shit in the links, okay, so that you guys can have it. Ooh, Jesus. All right, plenty of references here. Plenty of sources from this for this article. There's about references. From Institute for Health Metrics and Evaluation. I mean, there's plenty of references, about 52 references. If you guys want to check some of these out for yourself, don't just take my word for it. I'll post the links. Y'all can go from there. You guys can make your own decisions, make your own choices here. Okay? I'm not here to push anything. I'm just letting y'all know what's going on up in this head and letting y'all know why I don't trust the bullshit. Okay? I mean, we're freaking out over the coronavirus, which has killed, 50 people in the United States? And the flu has killed 12,000 people already. And no one's going nuts over that shit. Right? What's up with that? No full school closures for that. What was it? All right, so look. I'm not going to go through this whole thing, man. I'm going to just give y'all some highlights here, too. So, 2.56 million people have died from pneumonia in 2017. Almost a third of all victims were children younger than 5 years old. But no one... what's a third of 2.5 million? Almost a million? No, not almost a million. I don't know. Somebody do the math. What's a third of 2.56 million? Also, almost a third of all victims were children younger than 5 years old. It is the leading cause of death for children under 5. No one is closing schools for this pneumonia shit. All right? No one. Pneumonia is an infection of the tiny air sacs in the lungs called alveoli. In a person with pneumonia, alveoli are filled with pus and fluid, which makes breathing painful and reduces oxygen intake. Pneumonia is caused by a number of different infectious agents, including viruses, bacteria, and fungi. Here is the research entry we look at. Here in this research entry, we look at who is suffering from pneumonia and why, and what we can do to reduce the number of people dying from the disease. Here's a summary. Pneumonia is the leading cause of death for children under 5. No one cares. More than 800,000 children died due to pneumonia in 2017. While still too many children die today, since 1990, we've seen more than threefold reduction in child mortality rates from pneumonia globally. That's good. The global mortality rates for older people remain unchanged. Mortality from pneumonia is the highest in sub-Saharan Africa. The greatest risk factors for developing pneumonia are undernutrition, air pollution, and smoking. But no one is doing anything to get rid of cigarettes. No one's doing any of that. Undernutrition, air pollution. These things are a bigger problem than the coronavirus, especially for our children. Reducing exposure to risk factors and higher coverage of pneumococcal vaccines. Of course, they have to throw in the pneumococcal vaccines. Can reduce the number of deaths in pneumonia. All right, whatever, man. Research suggests that now, pay attention to this part, because I'm not gonna hide it from y'all. This is in here too. Research suggests that pneumococcal vaccines could be saving the lives of almost 400,000 children annually. I don't know about that. That's what they say. They also say anything to push a vaccine. But look at I pointed this out because I wanted y'all to see, okay, the coronavirus causes pneumonia. Well, people have been dying from pneumonia, 2.5 million in 2017 alone, right? Also, I want to point out, secondhand smoke over the last 10 years. They like to say that, the pneumococcal vaccine saved 400,000 lives. Could be, which means that they don't know. That means it's guesswork, okay? What also correlates with the reduction in children and others getting pneumonia is the reduction in secondhand smoke. People aren't smoking as nearly as much anymore, or they're smoking, they're vaping, or whatever the case may be. They still don't know how vaping will affect your life over the years, but you get what I'm saying. Let's look at all this shit. It just told you the greatest risk factors for pneumonia are undernutrition, air pollution, and smoking. Excuse me. The pneumococcal vaccine isn't going to stop that, right? Well, there has been a reduction in secondhand smoke. I don't care what nobody say. Y'all can look that up too. Go ahead and check my facts. So that's really all I got for that one. All right. I just want y'all to see that. All right. Now let's look at flu coverage. Flu vaccine coverage in the United States. I just told you guys the death rates of the flu are increasing. The annual influenza vaccine, hold on. It goes through all these things. All right. All right. Okay, so I'm just going through here. Now look, the behavioral risk factor surveillance system. This is based on to estimate the flu vaccination coverage for the U.S. population during 2018-19 flu season. Vaccination coverage with greater or less than one dose of flu vaccine was 62% among children 6 months through 17 years, an increase of 4.7% percentage points from the 2017-2016 flu season, and 3.6 points higher than the coverage in 2017-2016 season. Flu vaccine coverage among adults 18 years plus was 45.3%, an increase of 8.2 percentage points from 2017-16 flu season, and 2 percentage points higher than 2016-2017. Vaccination coverage varied by state, ranging from 46% to 81% among children, and from 33 to 56% among adults. And of the 10 states with the lowest coverage for children, 8 were also among the 10 states with the lowest coverage for adults. Interpretation of the estimates in the report should take into account limitations of surveys, blah, blah, blah. But y'all get the cut. Y'all get it. Flu vaccine coverage has increased over the years, but so has the deaths of the vaccines. The flu deaths. Flu deaths have increased. Vaccine coverage has increased. You see what I'm getting at here? So y'all tell me, are they working like they're supposed to? And are they actually causing the problem? Y'all tell me what y'all think up in the comment section. But for now, I'm going to get out of here. I got some shit I got to do. And I got to go wash my hands because I just sneezed all over myself and all that other shit. But don't worry. I have been fighting a sinus infection since since January. Okay, this has nothing to do with the coronavirus. I've been fighting a sinus infection since January with the goddamn vitamin C, vitamin D, and all this other shit. I did get blood work done, and I was sufficient. I was deficient in vitamin D intake. I was deficient in my vitamin D and some vitamin C. I was a little low on my vitamin C, a little low on my vitamin D, but my cholesterol, my hemoglobin, all the other shit was high. Vitamin D was down, of course, because even though I live in Cali, where there's perceivably a lot of sunlight, I'm still not getting enough vitamin D. You see what I'm saying? So I have been increasing my vitamin D intake from that point through oils and things like that, and I have been increasing my vitamin C intake, and the sinus infection has gotten a lot better. But right now, it's just I'm expelling the shit. You know what I'm saying? It's fighting hard, but I'm taking my vitamin C, my vitamin D, and my zinc, and I'm keeping it in this area. So it's not going down in my lungs. You know, it's staying up in here, and I'm just, the last of it is coming out. So it's very important that you get the vitamin D, because a lot of us are deficient. If I'm deficient here in California, Southern California, and I'm outside a lot, then it's the Northern Hemisphere, period. Okay, so if you're in the Northern Hemisphere, it's important that you do get supplemental vitamin D during the winter months. Now, during the summer, I'm good. I'm Gucci. During the summer, I have plenty of vitamin D in my system. But I've been slacking in my macking, and I've been taking my vitamin D properly. So this is what you get. Anyway, holla at your boy. Get your vitamin C, get your vitamin D, get your zinc, and stay healthy. Okay? And get your personal protective devices in order, and your projectiles. You want plenty of projectiles stored up. All right? For the people that overreact to certain things. But, you know, like I said, I put all this shit in the comment section, in the what they call that? Description box. I put all the links in the description box so you guys can check it out for yourself. Okay? Anyway, I'll holla at y'all later. Peace out.